I told you a little bit earlier this week about the red states, even the reddest of the red states like Wyoming, that are now looking at doing the Medicaid expansion as part of the Affordable Care Act, also known as Obamacare. There's a very, very interesting article which points out that Republican losses, Republican governors losing in the midterms could lead to millions of newly insured individuals. And I'm going to give you the list. It's amazing to me how we have millions of people that maybe they know it, maybe they don't. They are waiting around without health insurance. And if a Republican governor loses, the replacement is likely to push for a program that will get them health insurance. It's just a sickening situation, isn't it, Lewis? Having to wait around, and a lot of these people don't even realize that it's not President Obama that's preventing them from having insurance. It's their Republican governor waiting for a change to get insurance.
It's sad. I think about all of these people, and then I think about people who live in countries with universal health care, and it's just, I don't even know if many Americans have any concept of what that really means, what universal coverage really means.
Let's talk about 5 of these states. Wisconsin, Governor Scott Walker could be defeated by Democrat Mary Burke. We'll see. Maine, Governor Paul LePage is up against Democrat Mike Michaud. Florida, Republican Governor Rick Scott, Charlie Crist, Democrat, running against him. Kansas, Governor Sam Brownback, a Republican, challenged by Paul Davis, a Democrat. And in Georgia, Governor Nathan Deal, challenged by Jason Carter. Amazing. We have a system, ladies and gentlemen, where people are in states uninsured and they can't have access to what the federal government has already passed because their Republican governor is saying, no, I'm just not going to participate in this, regardless of the fact that it's initially covered 100% by the federal government and subsequently covered 90% by the federal government, in spite of the fact that these governors claim to be fiscally conservative, yet are doing something which is actually fiscally not conservative, which is when people are uninsured, they go to the emergency room. Not much of those bills will actually be collected. It is bad for the hospitals. It is bad for everybody. Just be fiscal conservatives and do the Medicaid expansion and get these millions of people health care.
It would be the fiscally conservative thing to do, but it would also look pretty bad to their constituents, even though it would help their constituents. It's a mess.
Remember those death panels, Lewis? The real death panels are the 17,000 Americans that will die because their state governments refuse the Obamacare Medicaid expansion. Those numbers according to the Health Affairs Journal. Remember yesterday's discussion about German philosopher George Hegel? A sliver of truth might be found in any insane notion. Well, we found the sliver of truth in the insane lie of the year, Sarah Palin a few years ago, of death panels, which is the death panels are the Republican governors choosing not to expand Medicaid. That's the Hegelian sliver of truth.
I guess so. In many ways, we could just look at Congress as a whole, as a death panel. They seem to make some pretty important decisions or not make those decisions.
We'll take a break. I have a great book recommendation for you today, and it's a very special book recommendation for a very particular reason, which I'll tell you about after this break.